Hi, my name is Jillian, and I'll be creating a mini simulation based on scenario number 1 for this week's assignment. Scenario: Mr. O is 63 years old. He was dizzy and lightheaded at home and almost fell. His wife brought him by car to the emergency room. Mr. O was admitted to AMU with syncope. This is not his first time being admitted to the hospital. He has been treated in the past for congestive heart failure and acute myocardial infarction. He feels he's pretty healthy as he only takes NSAIDs at home for chronic back pain. Mr. O got to AMU at 1600. His nurse is Jenny, RN, and she assessed him and found his blood pressure at 138/84. His pulse was 76 and regular, and his respiratory rate was 16. He is afebrile at 98.6 degrees. Mr. O's labs were normal, but his IV line infiltrated during transport. Jenny, RN, started a new IV and put warm compress on the outside or on the old site. Jenny, RN, reported off to Ben, RN, at 1900. At 2130, the PCA found Ben, RN, and told him that he had just helped Mr. O off the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Ben, RN, went in to assess Mr. O. His vital signs were blood pressure 94/66, pulse was 114, and respiration was 24. His pulse ox was 97%. He was pale and his skin was clammy. Ben, RN, asked him how he was feeling. Mr. O said he didn't feel well and could not get comfortable. He asked if he could have something for his belly. He mentioned it is really hurting. Ben, RN, assessed his abdomen and found that it was distended and Mr. O had diffuse abdominal pain. He rated his pain a 6 on a scale of 1 to 10. The pertinent information from this scenario is that Mr. O had a syncopal episode and has been taking chronic NSAIDs. He presents mostly normal to the emergency room until 2130, when he complains of not feeling well and has black tarry stool. His blood pressure dropped from 138/84 to 94/66. That's still within normal limits, but it is worth noting. His pulse rate also increased significantly. He is pale and clammy, and he has widespread abdominal pain. He also has a distended abdomen. For the purpose of this video, I will play the RN, and my husband will play the physician on the case. We will begin post-patient assessment, and I will switch my name to Jillian, RN, for this role instead of Ben. Number 1, I just got finished assessing Mr. O and noticed something urgent is wrong with him. Number 2, I have discussed the situation with the nurse preceptor, and they recommended paging the doctor on the case immediately. Number 3, review the chart for the doctor to call, which I have, and that's going to be Dr. Smith. Number 4, admitting diagnosis. So the admitting diagnosis was a syncopal episode, and date of admission is 1/6/2020 at 1600. I read and reviewed all progress notes from Jenny, the previous RN on the case. And this is the patient chart right here that I am reviewing. So for the list of medications he's currently taking, he's just taking NSAIDs as far as the scenario had mentioned. There's no known allergies that were mentioned. No IV fluids currently, just the IV catheter in, or the new one that was replaced, but no mention of starting IV fluids. Labs indicate no significant findings from when Jenny RN had ran the initial lab work. And vitals were blood pressure 94/66, pulse was 114, respirations 24, pulse ox was 97%. This was the most recent vitals taken. Obviously, we don't need to mention what Jenny took earlier at this current moment. And then again, the last labs that were ran were at 1600 on 1/6/2020, and no other labs, or we don't have any other labs to compare right now. So before we get started with the simulation, I just wanted to mention this is going over the SBAR that was developed by Kaiser Permanente, which basically will give the physician all of the information that's needed in order to move forward with the case if necessary. So we'll go ahead and start now. Paging Dr. Smith to the AMU. Paging Dr. Smith to the AMU.
Good evening. I received a page regarding a patient. What's the situation that you are calling about?
Hi, Dr. Smith. I'm Jillian RN in the AMU, and this matter is regarding patient Mr. O in room 211. Mr. O is a 63-year-old male, and he presented to the emergency for syncope at 1600, but presented normally. However, when I checked on him at 2130, he was complaining of severe abdominal pain and has abdominal distension. He also had a large black tarry stool and is pale and clammy.
Okay. Tell me about the admitting and diagnosis again and the date of admission.
Sure. The admitting diagnosis was syncope, and the patient was admitted on 1/6/2020 at 1600.
All right. Can you tell me the current medications the patient is taking, if he has any allergies, and if he's on any IV fluids, and any recent labs?
Sure. The patient is currently only taking NSAIDs for chronic back pain. The patient has no known allergies. The patient had an IV catheter placed, which was infiltrated and replaced at the hospital by the previous RN, but he's not currently connected to IV fluids at this time, and his most recent lab work was performed at 1600 when he was admitted but showed no significant findings.
All right. Can you give me his most recent vital signs?
Absolutely. BP is 94/66. Pulse is 114. Respirations are 24. And pulse ox is 97%. There's no other pertinent medical information at this time.
And what is your assessment for this patient?
Based on the patient's symptoms and vital signs, I believe this patient is suffering from a gastric hemorrhage.
What are your recommendations for the patient?
I believe the situation is urgent and the patient needs to be seen now to control the gastric bleeding.
Very good. I'll go and assess the patient immediately. Thank you.
Thank you, Dr. Smith. So now I am documenting the changes to the record and what the doctor is going to do and assess the patient. Okay, so now we're gonna debrief. Sorry, I'm really dark. Okay. My thoughts on the clinical scenario were good. I liked how the patient's information was reviewed multiple times so that the RN was confident about the situation. I also really liked the communication between all members of the hospital that were involved. So, from the beginning of the scenario, the other RN, PCU, and then the physician and the new RN. I thought that the SBAR was very thorough, and I wouldn't have added or deleted anything from it. All of the information that needed to be shared between medical professionals was shared, and nothing was left out. So that was really good. I also believe that the significance of the situation was displayed clearly, and it didn't seem overwhelming at all. Very straightforward. I appreciated how simple and clean it was. It went over all pertinent information while addressing the situation rapidly, so that the patient could get cared for as soon as possible or immediately. Thank you. I hope that you enjoyed this presentation about the SBAR by Kaiser Permanente.